an emphasis not having the academics at the center, although obviously you've, without you, this wouldn't have happened. But really, your concern, it feels to me, has always been with questions of social change. And social change is difficult. It's hard to do. It's hard to measure. It's hard to know about. I have my own kind of questions about that. But hats off to you, because I think it's actually shown what's possible. I don't want to talk too much. I mean, those are just some comments from me. I have lots of other observations that I hope that I'll be able to weave into the discussion. But I know that already there have been some questions which have been left over, Ursula, from previous sessions that people have wanted to ask. So should we start with those and then see how the discussion goes further? So Ursula, do you want to help us with?
Yeah, thank you.
Yeah.
There was a question by some about the I think it was in Indonesian when it was asked. So this has been an instructive documentary, and I particularly like the culture-centric approach from Yinka. Thank you. My first question has to do with policy about Pasung. Can you please say something about this? My second question is about psychiatrists, psychologists, faith healers, and the jinn controversy. How do we handle that? So I wondered if someone from the Indonesian team could respond to that, Asti or Diana.
Or also, even Ari is still with us, maybe Ari has been part of the movement. Perhaps you can say something about that.
Yeah.
You're muted, Ari. We will do it.
I'm sorry about that. The issue of Pasung really started to become prominent in Indonesia more than 15 years ago, I think. And the initial work had some considerable impact. The first province in Indonesia that actually started a Stop Pasung or Free from Pasung, Bebas Pasung program was in Aceh when we were doing the work there. So the governor of Aceh introduced a local law that then set up a program. Only about a year or so after that, the National Health Department inaugurated a national program. And that was in 2011 that the national program started. And they were very ambitious. They said by 2014 we will eradicate Pasung from Indonesia. We're in 2021 and we've just seen a film that has shown us quite a lot about what's happening, and I think it underestimated many things. It underestimated the lack of access to mental health care for people. Nearly everybody in Pasung in Indonesia had a psychotic illness of one kind or another. I think they underestimated all of the cultural issues that contribute to this as a problem. They also, I think, didn't adequately recognise how much poverty has to do with this as an issue. And so I think we can see that this is a very complex problem, and it's something that's going to take, in all places, a very long time to deal with. It's now on the international agenda very strongly. I think the Quality Rights Program is an example of that. Some of the statements from the UN on the rights of people with mental illness and so on and so on. But in a way, it's a kind of a flagship issue because it demonstrates what happens when systems fail. And they're not only mental health systems, but social systems that fail. So the kind of massive increase that we've seen in inequity that's been highlighted by the pandemic is a central issue for something like Pasung. And in some ways, if we can find ways to adequately deal with a problem like this, it means that we are actually starting to understand what the issues are and are starting to deal with some of the core underlying issues. So that, Astia, it would be good if you could comment.
Thank you very much, Hari. But before me, probably Ibu Diana would be the best person to chime in with her years of experience in this. If you may, Ibu.
Yeah, Pasung policy, we have like, I mean, some of the provinces have the province level of bebas pasung, free pasung movement, but I don't know, like we Hari as the actor or the one that who did advocacy in this, and that's very good that the Ministry of Health and all the province taking it seriously. If we are talking about mental health with them, they always talking about pasung, and somehow in some places even like misleading, like they think that mental health is only free pasung, something like that. Even something in even even in this the situation is like that, but it is not something easy to as you already saw in the movie, that the family sometimes don't have a choice, and the mental health system in some places is not really ready to have it to, yeah, that's a complex issues, and we are still working on it. Thank you.
Yes, and if I may add as well, and the credit must be given when credit is due. The policy has the introduction of new policies for banning of pasung and the management of patients and clients who were in pasung has been really improving the situation. However, the implementation on the ground is still very a little bit stagnant, and this has to do, perhaps there was a scene in the film from Indonesia that was very telling. There was a situation when the patient in pasung was put in pasung by the family, and the family is only a mother who is already in her 80s. She has, is a widow, and the late husband was the one who was sounded like more like he was more in charge in the care of the son. And the priest from the Chameleon Order in the local Flores city has come to help, along with the workers from the community health centers, and they came, and it's been a really great process of introduction between the family and the health workers, and they have been given medication. But as the health workers in the Puskesmas testified, medications are hard to find, and they even had to ask the help of the church of the Chameleon Order to provide it outside of the stock from the formal distribution. And even then, there was a discussion between the priest, who was also starting to be more experienced along over time, interacting with health workers and with patients, knowing about the administration of injectable psychiatric medication, in which the use for which some health workers in the community centers are still not as confident, and they would need to consult with the local psychiatrist. and there was only one psychiatrist in the island. So all of these factors combined were kind of like a huge reflection of the challenge in the field. We also give a very commendable appreciation to institutions that have helped in training nurses and GPs in the very community level setting for providing the care. But we also will need social works, as Leslie said. This is, as Harry said, this is a failure of not only the health system, but also the whole system. And I think that that's a reflection of where we need to go as well as where we are now.
Can I add one more thing? This issue also demonstrates the limits of law. Pasung was made illegal in Indonesia in 1978, I think it was. So there has been a law which has banned Pasung very clearly for more than 30 years, but never implemented, never actually followed through on. And one of the problems that we now have is that, you know, countries are developing mental health laws and they're developing mental health policies and so on, but it doesn't mean anything unless they are fully implemented, which means having adequate funds, having adequate human resources and all of those other things.
Thank you. I seem to be, no, you've woken up again. Suddenly everybody went frozen and the joys of the internet. I mean, thank you for that. I mean, one thing that sort of struck me about the, just the responses to this question that I mean, there were multiple, but a couple of things that I think is also a feature of the way in which your team has worked on this project is you understand when a practice is not a good practice, and you understand what should not be done. It is so easy from the outside simply to jump to a discourse of blaming people who are right at the interface. And again, I think the story you told us about, you know, the particular circumstances that people find themselves in, which is precisely related to the broader social issues that Harry was talking about, which are actually global. They're not only national, means that the solutions are not simply kind of moral. And I was very pleased, Harry, that you mentioned the issue of the limits of law, because I think it's very important for all of us who are interested in health and human rights. There are, I mean, I live in a relatively young democracy where there was a time when policy development was incredibly important. But if I see another project which says, you know, I'm going to develop a new policy, I'm going to scream, because the question really is, are policies actually enacted? And actually policies are often constructed not in relation to the local experience of issues, but in relation to donors, international agencies, and so on. So it's with an eye outside of the country, and then completely separate things may happen at the country level. But I see we have a number of hands. I'm not sure who was first. I think I'm just going to go across my computer. So the person who's on the left is mine. You wanted to make a comment.
Thank you. Can I first say that these are two remarkable films, and with so much food for thought that actually I feel they need watching at least a couple of times to really grasp the depth and the narrative, and also to appreciate the connections between the two. But I first wanted to say that I think the cinematography, the filming was outstanding. And also to find a narrative through the material, which is the role of the directors and the editor, is also remarkable. And I think particularly from the Indonesian film, the way you've been able to weave together the stories of so many different examples and stakeholders at the same time as having kind of the thread of Indah and ending with this wonderful melokat kind of ritual transformational practice by the waterfall, I think was really wonderful. And so I just wanted to really identify the editors, Nadia Astari, I forget the editor of the Ghana film, who have really done a remarkable job, and to Emilia for the incredible filmography. I was left by there was a dominant narrative in the Indonesian film which started with which ended with the benefits of collaboration from so many different stakeholders, and then the Ghana film started with the collaboration in a really wonderful way, so in a way picking up from the Indonesian film, and then ended with the celebration of the work of the mental health workers and acknowledging too the Prophet and also one of the health workers who had passed away over the last year, which was very deeply touched me. But I was struck that there were some things that you can't help but looking at a second film through the eyes of the first, because when the first film leaves an impression, it would have been the other way around had we seen the Ghanaian film first. And so there were some things about the collaboration in the first film that I kept on asking myself about the Ghanaian context. And there was one collaboration in particular in the Indonesian context between Dr. Rai and Dr. Kumai that really struck me, and it was particularly from Dr. Rai's perspective, that he didn't quite know how this collaboration had arisen. It was kind of fortuitous, magical. There was an empathy there was a connection, there was a humor, but there was also a seeming love between the two that really struck me. There was a kind of a magic in their collaboration that you couldn't really turn into a prescription for how collaboration could work. It was kind of organic in a way. And it was captured in the way they looked at each other and also the way they celebrated this one individual who made the whole audience laugh, telling his personal history. And so I was also kind of fascinated about how these collaborations worked in the Ghanaian case. I couldn't help but thinking, yeah, what were the bases of, George talked about it a little bit at the beginning, but there were also other collaborations of how they emerged. And I wonder if the edit is not completed on the Ghanaian film, whether some more information about that could be revealed. You know, the wonderful way in which George continues to work with, and the other protagonists continue to work with the prophets and the ministers. And yeah, what is the kind of the idiosyncrasies and the mysteries really in their collaboration? Because I guess for me, it's in this human and empathetic and mutually supportive and loving relationship that lies a lot of hope for the future of collaboration between the protagonists, not only in your two field sites, Indonesia and Ghana, but in other places. So if there's a kind of a message for the other places, for what are the kind of some of the wonderful ways in which collaboration can emerge, and I think it's in the ways that you've identified. And that's just the one thing I wanted to pull out, because there were also so many other magical aspects about the two films. And so I just wanted to end by saying I'm incredibly grateful to have been part of the process and being able to contribute. And yeah, these two films are remarkable works that are unquestionably going to have more enduring impacts and influences both in Ghana and Indonesia, but also within the wider global mental health arena. Thank you.
Oh, thank you very much. Before we get into the next question, I mean, let's just. I'm sure there's some reactions to what Mike has said. I'm thinking, you know, particularly, I think, Mike, you were saying that there was not as much as you would like to have seen from Ghana. So does anybody from the Ghana team want to respond initially?
I can take this. Yes, as we mentioned in the beginning, we are still in the process of editing our film, but there's some really good comments, Mike, that you made about, you know, highlighting more the relationships or the nature of the relationships. I think what what was a bit different in our context was the emphasis that the health workers put on the position and the authority of the healers. So it wasn't so much, what's the word, familial, or so that it wasn't so much as seeing them as another health practitioner, but they had to go there with the recognition that this is somebody who is in a position of authority within those communities culturally. And so I don't know if you saw in the beginning when George got to one of the healers, even as he was greeting him, he bowed a bit, and it's in the nature of the way they interact with him. The other healers, some of the nurses, as they were talking to him, they had their hands behind their back. It was more of an authority figure and a subordinate kind of relationship. And that's one of the things that the nurses often told us they emphasize. Going there with the idea that I'm coming there to show you respect for your authority, but I would still like to work with you. I suppose that's one of the differences, but it is worth looking again at our footage to see that maybe we might have instances where, we could see that camaraderie, in a different way. So thanks for that comment. We will definitely keep that in mind and work at it.
Thank you, Lily. Ursula, are you talking?
Yeah, sorry, I thought I'd unmute myself. I think George wanted to say something, Lily, was that right? About building collaborations, because I wondered if you wanted to reflect on that, because I was thinking exactly the same myself, that there are these differences in terms of the authority and status, in terms of age, and as well as position. Yeah.
Yes, I had a little chat with George during the break, and he was saying that he could reflect a bit on, and this was based on some of Harry's initial questions about how the collaborative relationship, the process, how it worked and how they approached it. So I don't know if George is still here, but George, if you are, using that earlier point and also Mike's comment about, what is the kind of relationship you have with them? Do you see them more as your fellow health workers, or are you emphasizing more the fact that they have a certain level of position within the community?
Hello?
Hello, yes.
Go ahead, George.
Okay. Yeah, so, before even our existence, or before our community, these people existed. And because of this, we must acknowledge their position in the society. We are not there. One thing we know that we have been allocated a power as a service providers, but we must know that once you are entering to someone's territory, that person also has some power. So we don't go there to challenge them, but the issue is the aim of collaborating with them to make sure the service users at the end of the day achieve recovery. They, in a way, have a fear that these people coming down, they are coming to tell us that we are not doing their best. And this is the modern way. So they hold some perception that we are coming to condemn what they do. Once they have that perception all the time, they hold a defensive position trying to suck us away. But we make them aware that we are not there to condemn what they are doing, because they have spiritual powers and they believe a lot of things, but we are not there because we cannot interpret what happens spiritually, but we are there to take care of spiritual aspects. So we go there with humility and we give them maximum respect. What has made all our collaboration work is respect. Respect is the key word here. We go there, we are trying to explain things to them, and because of this, even in the absence of cases, they call us to check on us. They see us as their daughters and sons, or they check on us, and we feel comfortable. It's not easy for them to give their, hand over their puppy to you. Sometimes they even invite us to their shrine. So all boils down to humility. Once you make them, you humble yourself with them, make them that you are not there to condemn what they're doing, but you are there to work with them. And that ends everything. And that was the key word that made us successful. Thank you.
Thank you, George. Thank you very much.
Thank you, George.
Thank you.
Leslie, can I just comment briefly on what a part of what Mike was speaking about? I think, Mike, when you focused on Dr. Rao and his colleague, whose name I've forgotten, But he said something very interesting. We come at this, he's a psychiatrist, we come at this with a medical perspective, but we were born in Indonesia. And so at the base of it all is a kind of common cultural roots. And I think that commonality of cultural origins and so on is absolutely critical for this kind of collaboration to emerge. Of course, there are all of those other things that you mentioned. There did seem to be some really strong connection between the two. They seem to understand each other very well. But I think more broadly, that comment about, you know, we're Indonesian first, and then we're a doctor or we are something else. Is just really important.
Yeah, I think what really strikes me from the film is looking at it as, again, as I've been doing just recently, is there's 2 points in the film where George and one of the healers talk about this being about Ghana's development. That if they work together, it's for Ghana to move forward, as a country. And I think that's really very striking, actually, that it's a common endeavour for the sake of the country, for the country to come together. And also George comments about the share that they're all Christians or Muslims, that, you know, people have, you know, that most Ghanaians do have a faith, and it's a very big part of their life. And how so this enables that collaboration also to happen. I think particularly we saw that, I mean, what Mike was saying about this kind of sort of close relationship. I think the relationship between George and the pastor of the Holy Healing Church, you know, was quite that had been quite long-standing. There's quite a lot of camaraderie in that relationship. So the relationships were different. I think it was, you know, with the traditional healers, it might be slightly different because there isn't quite the same shared faith, and it's a very different way of, it's a very different cosmological kind of viewpoint from the traditional healers that some Christians in Ghana don't fully approve of. But as George was saying, you know, they go with humility. The people are experts; they're experts in the spirit world, and that's respected, as he said. I don't know if you want to add anything, Lily, to what I've said.
No, I think you've covered it all.
we might come back to that. I know there are 2 hands that have been waiting. I think the first one was Vegas. I think you were first. Yeah, if you would mind unmuting yourself. Yeah.
Okay. I think when I'm looking at the film, people should understand that such collaboration, for example, like Dr. Rai and the healer, it is only possible because of the works years behind. I was there in 2011 before the free passung movement from the Ministry of Health. I met the minister to advocate that. But before that, the huge work was started by building support group for mental health, which I already started. Because at a long time ago, the healer have a huge bargaining positions because of the lack of the mental health facility. Yeah? We don't have universal health coverage until 2014. So people were having difficulties to access mental health service. That's why the traditional healer have a more bargaining position. People go to the traditional healer more than people go to the doctors. I start the the campaign for mental health long time before the movement of Free Pasung. And then in 2011, Dr. Irman Shah, the head of mental health department in Ministry of Health, asked me to support him to launch the movement. He knows that it is very ambitious project, and the Minister Ibu Endang Rahayu Sedianingsih remind him that it is very ambitious that you put 2014 as a deadline for a Free Pasung. You cannot do that in a government program, because people will ask you the result of the movement. But then after the discussion, we agree that we need something to bring a huge awareness to the people of Indonesia that there is still Pasung in Indonesia. We have to make this huge campaign so that people, even though this is a huge burden for the ministry, but we should do that just to make awareness for the government, for the House of Representatives, for general public. Then we agree to launch that movement. But until 2014, it was not, there is no big result for the Free Pasung. Then it continued to 2019. During that time, the effort is still very difficult, but then we have a big presence from the government that the President Susilo Bambang Yudhoyono launched the universal health coverage. Previously, when I educate families about how important it is to get the medication for people with schizophrenia, yeah. Like I already met Pak Nur Hamid a long time ago, yeah. Pak Nur Hamid already free about 200 people from Pasung. During the presentation, I heard that. But as a family members, I doubt that the program will succeed in a long term, because if you still don't have any financing scheme to help families to get medication, Free Pasung is only just a number. Because after you free the people, you get 1 month medication in a hospital, come back to the family put the Pasung again. But in before 2014, when I told families to get the medication, it is very difficult, because how come Bagus medication is very expensive for us. It is not available in local hospital, because not only the financial problem, but also the amount of the psychiatrists in Indonesia is very limited at that time. 1 for 400,000 people, yeah, and mostly in Java and mostly in the capital in Jakarta. So it is to make a campaign is very difficult. But then in 2014, we have universal health coverage, and then it is easier for me to tell people to access mental health services. And then we have a big push in consumer movement. People are more and more educated about the importance of mental health care, yeah. that during that time until now, the consumer movement in Indonesia is getting stronger. We have nowadays we have so many support group in Indonesia, online support group and offline. They educate each other about mental health. That's why we have more bargaining positions to traditional healer. Previously, if you talk to traditional healer, they also always told us that psychiatric medication is poisonous. Just like you saw from the movie, the film, that they always said that this is only temporary, just for a few hours. Drugs is only for a few hours, and traditional healing is for forever. You can recover forever. That's why many families.
Yeah, sorry to interrupt. I'm just concerned about time. If you could
Okay.
wrap up your comments.
I go directly. Then after we have a big bargaining position, then the traditional healer become more open to the mental health knowledge, modern mental health knowledge. Then now it is possible to make collaboration, because without that bargaining position, the consumer become object of the traditional healers. Many of us spend so much money for them without any result, and then they don't encourage us to access mental health service. That's my comment. Okay.
Thank you very much. I mean, what's absolutely clear is, we've got what, sort of 15 minutes left, and we actually should have 3 days to discuss everything. So I always feel bad interrupting very good comments. But I was so reminded during your talking about, President Mandela's book was called Long Walk to Freedom, and you've really been describing a long walk, which has been spoken about in many other ways. But before we carry on, I know that Shark has been waiting a long time to talk. Apologies, Shark, for keeping you waiting, but your time is now.
Okay, thank you, Leslie. First of all, my congratulations to the whole team of the Ghana film. It's fantastic. You did a very good job. And I want to pick out a few points which struck me in particular, or elements that I thought you are very successful in showing and explaining and making more clear. The first, of course, was that you gave voice to the patients themselves. Now, I've been stressing that before, that I would be so interested in hearing their point of view about the whole situation. And particularly, I think it was Malik and his father. Now, it was so, I'm almost becoming emotional. Such a true and respectful and balanced and honest and brave of Malik to come in, to show his face to the whole world in a sense. So I think that was a very good part of your film. And also I think the other person was James, but James could look back on a success story in a sense, which is not true for Malik, at least not to that point. So it's more difficult for Malik. And his father was also great. And summing up all the problems attached to it, also the financial problems, it's all the time the finances. That's one thing which I really have to congratulate you. And I think, and that brings me to my second point, I think the film can be and will be hopefully a very good medium to promote more respect and understanding to the whole population in Ghana about this type of illness. You know, and what if there's something missing in the film in a sense is that you give a very rosy picture of how mentally ill people are treated and are looked upon. Because only in the end, if I remember well, this short talk about witchcraft and discrimination, but but this film showing the family problems and the voice of the patients themselves, I think will really help to engender more respect and understanding among the wider population. And I think that would also be a wonderful result of your documentary. What I also liked very much is the theme of love. I mean, I think from the whole, all the elements, all the parts of the film, people stress the importance of dedication and loving them. And if you don't love them, you know, the first thing is you have to love them, and not only the family, but also the caregivers. And I think it was George who mentioned that they're using kinship terms. You know, my father, my brother, you know, this also shows this close relationship between caregivers and care receivers. What else? Yeah, of course, closely related to that, the family point of view. You see, so that I think was a very strong point too. Especially, of course, all the mothers and fathers and brothers who were speaking about the person in the family who was suffering from illness. More of a perhaps a technical aspect of the film was what I liked very much was while some of the experts were talking, you showed us so much about daily life in Ghana. You know, you see the village, you see the people moving, how they transport, how they visit each other, how they greet one another, livelihood, cocoa, sex with cocoa beans, etc., etc., etc. I think it places the specific aspect or the specific topic of the film in a wider context of society. So I think that was also very successful. I understand we have little time, so I will stop here, but I will finish with congratulating you again, and I hope the film will meet a good reception. Thank you.
Thank you so much, Shaka. It just strikes me that if we wanted to advertise these films, you've got to capture, and I'm very pleased this is all being recorded. So just put down with Shark's permission what he said, and you've got the, you know, you've got it in a nutshell. And like I am.
Sorry, Leslie. Sorry to interrupt, Leslie. If I could just quickly, in reaction to Jacques' comment,
Sure.
I wanted to acknowledge. Yes. I wanted to acknowledge. We just found out a couple of days ago that unfortunately Malik, that young man that we saw in the picture, has also passed away.
Sorry, can you repeat that?
Malik, the young man you spoke about in the video. Malik. We just found out about 2 days ago that he had also passed away. So just wanted to acknowledge that we're still not sure what happened, but we are going to try and support the family in ways that we are able to.
And you'll add,
so just to acknowledge that we will add his name. His death in the end of the film. Yes, I think. Yes, it was too late to do that now, but we intend to do that as we continue the editing.
Okay, great.
I think there's one more hand before we wrap up. I think that's you, Anton.
Yep, thank you. It's me.
If you can keep it brief, please.
Yes,
Just because of time.
Will be, yeah. So thank you, everyone. Thank you, Prof. Leslie, Prof. Harry, and everyone who's gathered here. First, I would like to appreciate both our teams, Ghana and Indonesia, who I think has done great work on this movie, especially on protecting the privacy of the participants' concerns, making sure of involving people with lived experience, being respected in so many ways as when I watched the movie. Therefore, I think this movie is great and might become a powerful tool for mental health advocacy and policy improvement. Especially, I would like to highlight too about how we can show that in the movie we can see how it usually the two side of contradicts. Well, the healer traditional and the practitioner in field sometimes we argue and not really in line in terms of making this patient recovery. But in this movie, we can show that it can be embraced as part of the together working on the recovery process that embrace as well the community and mental health services. And yeah, however, this movie also shows the sad reality that the pasung are still existed. As when I see this patients that being changed, it was heartbreaking for me to see, as if like we can see that what it feels this when a human being treated like this way. So I hope, yeah, it will help to advocate and educate people. And in terms of mental health policy and law about pasung, I would like to comment as well. There has been some movement a couple of years ago when we, Mas Bagus and I were invited to the ministry to talk about the policy implementation and building the derivative law from the mental health law, but which aim to help people on eradicating pasung, reducing the number or anything about the pasung that will be aimed for as a source of a law that for the province to make it to stop the pasung. But however, as far as I know, correct me if I'm wrong, it was still stuck in the ministry level. Some bureaucracy and everything. So yeah, it was a practical implementation, still has a lot of challenges in terms of finance and integration and everything. But there is still, I'm hoping, and there will be still hope. We are moving ahead and might stop a bit during this COVID time, but yeah, I hope there will be improvement in the future. That's all my comment. Thank you, everyone. Thank you very much.
Thank you. So we've heard about some important common themes that we've heard. We've just heard about hope. Thank you very much. That hope is really important, and hope is what sustains this long walk, which we also heard about, and we've also heard about love. And I think all those are really important. Unfortunately, we have a very short walk to the end of our session, and it's important for us to hear about what's next. And if I'd been a better chair, I would have organized for each country team to talk on that. But I think we've got like 3 minutes left. So I think, Emmy, you're probably the person best to put it in a nutshell for us.
Thank you so much, Leslie. And yes, we'll try to wrap up now. And I know that it's been a very interesting conversation, and we could keep going, as I was saying, 3 days. So this is the beginning of the kind of release. As we mentioned, the Indonesian film is final. I mean, you never can say final until it's not been out in the world, but it's the final. And for the Ghana, is close to the final. So the next will be finalizing the Ghana films. We're going to be submitting them to festival initially, and then releasing them publicly. So they will be available for free in the website. I have put updates in the chat, some links for people who are interested to be part of next future screenings, as well as follow our future outputs. I think also reflecting on the discussion today, I was taking lots of notes, and I think after we close, probably we'll be going and thinking about so much was shared. And I guess my immediate response is, and I speak, I believe in behalf of the team, thank you for the very encouraging words, as you mentioned, looking at the film, but also knowing the topics. Obviously, in the group here, there is people expert for the respective countries by lived experience, professional or both, and others. It is a very complex, challenging issue, and I guess we are exploring it. It's not the end of the exploration. In fact, it was interesting at the beginning. We were chatting to each other and already sharing ideas about future projects. So, okay, we could be doing this next and this next, and which was very, very, very sweet, I think, and very important. Also indicating how this kind of project will reveal some aspect, help us to learn about what are some common shared elements we can notice in Ghana and Indonesia. And I'm very pleased to see that you all, even just with the 90 minutes, you have a lot of hours of footage, I can imagine, but even just having what you saw, you were able to capture some common elements. And we hope really to be able, through the films, through the publications, through policy engagement, whatever, all of us, we are a very interdisciplinary team working in different contexts. And as Ursula mentioned, we are very lucky to have you as a steering committee, and we know this is going to be a continuing journey with you all to make the most of whatever we explored. And I hope this is going to be just one part of a continuing journey with all of you. There is a lot of people to acknowledge. I know we are running out of time, and you have been fantastic to be here until now. So we'll acknowledge the participants again in the project, all the institutions and the people who have supported us and are still supporting us. And the specific people are named in the films and the publication. So I will not go in details in there. I want to also thank, of course, our chairs. So Harry has been there since the beginning. I know he's late in Australia. So Harry, grazie mille, and good night. And Leslie, I know that you were panicking, you want to be able to be with us. So I'm very, very pleased you were able to be with us in the discussion. And Annabella, I don't know if she's still here, but thank you so much for the fantastic sharing. Thank you to CPMH to actually looking after the technical side of this online release. There is always a lot of organization, and we are very lucky to have the fantastic team, Universitas Gadjah Mada, to be able to take care of the technical side, and Asti and Lily and Ursula and the rest of the team for being fantastic companion in all of this. And well, we will see you all again in our next screenings and next events.
Thank you so much. If we were in an in-person event, I'd be running to hug you all. So I don't know how you do that, but that virtually. But maybe, I mean, it's exactly on the hour. It's very late for some people, early for others. But hasn't this been wonderful? I hate saying goodbye, but if everyone, you can turn on your sound, turn on your screen, and we can all say thank you, goodbye. Thank you so much, everybody. This has been absolutely wonderful. Congratulations.
Thank you,
well
Mas
done.
Bagus.
Take care.
Thank you,
Pak
Jacques.
Nur Hamid. Yeah.
Thank you, Nur Hamid.
Thank
Yeah. Nur Hamid, thank you so much.
you,
Thank
Enjoy.
you, Harry, for staying
See
very
you,
late.
Amy. Thank you, Leslie. See you.
Thanks,
Thank you very
Leslie,
much.
Harry,
Thanks,
Annabella.
everybody. It's been fantastic. Thank you.
And thank you, Leslie. And before we
Joseph is
ended
here as
this,
well.
because we started,
Hi, Joseph.
Thank you, Amy.
because we started this whole series of events.
Bagus, hope to see you in Indonesia sometime soon.
Yeah. Absolutely.
Asti, you trying to say something, Asti?
Yes, well, because we started this whole event with a moment of silence, I guess it's only appropriate for us to also end it with a moment of silence, and with all the appreciation to everyone who has attended, and also with our thoughts go to Malik and his family for the late Malik and his family, as well as an acknowledgement that one of our own Indonesian Advisory Committee members from Yogyakarta, from the KPSI Yogyakarta, Fermi, has also passed away, and I think we all need to acknowledge their contribution. And for that, let's take a short moment of silence. Let's begin. Thank you for taking that moment.
Thank you.
And again, without blowing the whole climax of the event, thank you very much for attending, and we'll hope to see you again in the next event.
Yeah. Congratulations,
Thank you,
everybody.
Bagus.
Well done.
Thank you.
Thank you so much, everybody.
soon.
Thank you. Thank you. Bye-bye. Bye-bye.
Take care. Bye-bye. Ciao, Nur Hamid.
Thank you for coming, everyone.
Hanan, thanks for coming.
Thank you, Mbak Citra.
Terima kasih, thank you.
Sama-sama.
Selamat malam.
Iya,
Sukses.
selamat malam.
Yes,
Terima
great.
kasih, Mbak Citra.
It's fantastic to see this incredible work.
Thank you.
Thank you. Thank you for being with us to the end. It's very nice. Nuramid, show us, where are you? Where is Nuramid?
Nur. He's there.
Where are you?
Thank you, Dr. Mahar, for coming.
Mahar is still with, yeah, it's okay.
Ya, Pak Nur Hamid, terima kasih Pak Nur Hamid.
Sama-sama, terima kasih Dr. Diana. Buat semua terima kasih atas jumpanya ya.
Ya, see Dr.
kasih.
Mahar Agusno is also here.
Yes.
Mahar, how are you?
Thank you for joining us.
Yeah.
Well, from
Kalau kita bisa temu darat lebih menyenangkan.
Allah tahun depan, semoga. Sehat-sehat Dok, Sarjito ini ya, sehat-sehat.
He asked him I want to stop the recording just in case.
Yes, that's true.
Okay,
well, we finished on time, which is wonderful. And things went smoothly, all things considered.
Thank you for your contributions, George. George is still here.
Is it George still with us?